Shafi, we are walking in Toronto. It's a tiny bit chilly. Well, for you, not for me. I came prepared. And we are here to talk a little bit about your book launch, which you are doing here. So, first, very important question, why do we need another book on AI?
Well, that's the million-dollar question, isn't it, really? So actually, if you look at the literature outlets available, there are very few books currently available on AI in healthcare. In fact, if you see the last great textbook of healthcare and AI, it was called Deep Medicine by Eric Topol in 2019. And things have changed over the last 7 years. We now have large language models, we have lots of new innovations, and we have new use cases. And so I thought it was high time that we had a book around AI to encompass all the changes that we've seen more recently. So although we think there's lots of books out there, not one that I thought was relevant for healthcare professionals and leaders across the world.
So what exactly are you covering that makes it relevant for healthcare professionals? How is your approach different to any other approaches or news that we see in the daily news about AI in healthcare?
Another really good question. Oh, I can hold it, of course. So another really good question, I would suggest, because I've already mentioned earlier that the world has moved on a long way in AI. Now, the reason why I wrote the book was for a number of reasons. The first was to improve AI literacy. I've taught AI at business schools and medical schools the last 10 years. And when I've been around the world teaching, I realize the average literacy of AI is quite low amongst healthcare professionals. That's from...
What do they usually know and what do they not know? Sorry, this is going to be a bit tricky because we just have one mic. But so where do you see the biggest gap in knowledge around AI?
Well, everything. I mean, the actual knowledge is actually quite low. People don't know the history of AI, where it's come from, the timelines of evolution of the major milestones in AI. They don't understand how, for example, LLMs might work. There's issues around ethics and the governance, around the regulations, for example, the use cases across different specialties. And being at the center of that over the last 10 years, of course, it's in my kind of comfort zone. Others aren't as comfortable. The other question is, where do you go to get information? You can go on social media and see various links or various posts. You could go onto the tech journals. You can see the news, for example. It's everywhere. And so what I've done is try to convert all of those pieces of information into one book. But it wasn't just about the technical exercise. That's the important thing to say about this book. It's about storytelling. It's taken a long while for me to understand how do I tell the story to the average person who has no knowledge of AI to pass the information on in a way that they can understand, and that was the main challenge for me.
Yeah. Why would clinicians need to know the history of AI? The first thing that I thought of was, as you know, the whole debate: do clinicians still need to know the Krebs cycle in today's world, where there's so many other things that they should know? So, how did you choose what is essential to know, and to which degree do you think that doctors need to know how LLMs work, what's their history, etc.?
So no one needs to know the Krebs cycle inside out. Of course, they need to know the function of the Krebs cycle, what it's of use. I agree with that, but we're not asking for those kind of information. If you look at AI from its inception, really back in the 70s and early 50s, there are certain milestones that are key to understanding. Whether it's the IBM computer beating the world chess champion, whether it's Jeopardy champion being defeated by an AI platform called Watson, or indeed where the AlexNet paper came in 2014, which described the deep convolutional neural networks, which then led to where we are now with the LLMs. Each of those is a point in our history that's relevant, worth knowing about. So even in medicine, we know about penicillin, Alexander Fleming. We know about Edward Jenner and the vaccines. We don't talk about, hey, do we need to know about the history where it's come from? We do. It's so important. So the book is actually called Intelligent and the Evolution of AI Transforming Healthcare. So I've taken the reader on a journey of discovery of AI, and then also around, okay, we know where it's come from. what's the future, what are the use cases we can then align ourselves to in different specialties in clinical practice. And there's many themes in the book which we can discuss.
When you announced that you are publishing the book, you said that this is not a book about glorifying AI. So what is it? And what exactly do you talk about and discover in relation to the impact that AI will have on healthcare? The last time we spoke was at WHX Tech in Dubai 6 months ago, when John Nosta challenged you that AI is going to replace radiologists and clinicians. It's just that those who said that first got the timeline wrong. So they predicted that it's going to happen sooner than it actually is. So what are you predicting? Are you predicting anything? Like, what's in the book?
That's a really interesting conversation we had in Dubai. So I've actually changed my thought process around AI itself. I was also a person who felt, yes, AI would change everything. Yes, it would replace doctors, or at least make us more efficient in the long term. And radiology is one of those specialties that was highlighted by Jeff Hinton in 2016, where he said that within 5 years, we will not be appointing any more radiologists. And that was clearly wrong. What's really transpired in my own mind, the way I think about AI now, and it's about that central question of human agency. Where do humans sit on this table? Can we determine our own future? Can we be the control mechanism, allowing AI to be adopted in a safe and efficient manner? So I'll give you a few examples, which I'll talk about later when we do the book launch. And that's basically, I've had a few debates, one at the Oxford Union, one at the Royal Society of Medicine. And what I've noticed from these conversations and debates is that whilst AI has a huge capacity and will change healthcare, of course it will, that will become unrecognisable. At the same time, we have this human connection. Yeah, I'll talk about the human connection. So I'll give you a few examples. We had these debates, one at the Oxford Union, one at the Royal Society of Medicine. One of the questions from the Oxford Union was basically saying that will AGI, that's artificial general intelligence, be humanity's last great invention? And the question at the Royal Society of Medicine was that will AI radically change the role of the doctor in the future? Both these questions, initially when we went to the debate, most people thought, yes, they will radically change doctors, or yes, it could be humanity's last great invention. But then in the debate, what was powerful was the fact that people needed humans at the centre, human in the loop to control. And actually people weren't going to change radically, because their role as doctors is still similar as it was now. Yes, it'll make our lives more efficient, processes will change, etc. But who we are as human beings, and that's about the clinical connection with the patient, the hand-holding, the empathy, breaking bad news, having conversations, that art will never change. So that's kind of where I'm coming from. The central theme, like, yes, AI is fantastic, it's wonderful, great technology, but can we also control that destiny in a way that's measurable and safe for the patients and for us as humans? Also continue that role of providing that support from a humanistic perspective. And that's the kind of the balance here, isn't it? Technology is coming fast and quick and rapid, but how does that help support us in the way we shape our own personal journeys, and particularly healthcare? And that's the central theme of the book itself. Not to be afraid, not to have the fear factor, embracing it all, but understand limitations and where the ethics and governance might lie for us.
Do you actually see a lot of fear about AI from the clinical side?
I see a bit of everything. I see patients who don't understand where AI might be, and part of the book is also to empower patients. This is a book for everybody, including the end user, which is the patient. Doctors, yes, they don't understand what's going on. There's a fear factor. And I think the book itself is designed to say, look, there are certain issues we have to be careful about. We have concerns, anxieties, but actually, if you approach it the right way with a knowledge base, hence going back to history and everything else, we're able to make better decisions for ourselves. And I want to put the power back into every individual citizen. If you look at AI at the moment on a global level, and I was watching a great podcast the other day with the major companies like OpenAI, like Anthropic, and the others, control the output. They control who we are almost. So my feeling is, yes, lots of resources are now going into building cloud computing and computing power, for example, a huge amount of money being invested, but actually that's taking control away from us as humans and citizens. And their drive is, of course, revenue. Their drive is to go to AGI. Is that the drive that we have? Or can we define how we use AI on the terms that we believe in that's safe? That's the conversation, and that's the theme of this book. That yes, we have the ability with our knowledge base and skills to deploy AI in a way that improves patient outcomes or improves patient experiences. So yeah, that's the kind of one of the themes that travels through the book.
To which extent do you think we can prevent AI from causing harm, not just in the sense of actual patient outcomes, but also the relationship between the doctor and the patient? So, for example, one of the main premises of the scribes was that it would bring back time to the discussion between the doctor and the patient, but like research now shows that actually yes, clinicians are doing just more work. And also what's super interesting in the US is that now the challenge that everybody's trying to address is how do we make sure, so basically scribes are increasing costs, because before, when doctors were billing or just doing the notes manually, they didn't necessarily go into all the detail that AI is now able to dot down and also connect to the billing codes. So, yes, hospitals are potentially making more money, or just like doctors are potentially making more money, but the cost is going up. So now it's a question of, will the insurance companies try to change the coverage to reduce the cost again?
Yeah.
So we always go into technology with the best possible intentions, but then there's always the negative consequences or side effects that we don't think about.
Yeah, so there are a couple of points to unpick here. The first one is creating inequity in healthcare. Because if you bring these technologies in at a cost, does that then make the inequalities much higher on a global level? As you know, I'm a global health advocate, and so therefore there's real risk of creating inequity. But at the same time, if you look at just scribes, what's called ambient voice technology, that's one at the moment that's being most widely deployed because it's quite an easy bit of AI. It's just voice to text and putting into categories. It has saved time, because before, if you think about my process as a surgeon, I was sitting there dictating a letter. That letter was then going off to someone to type out and come back in. That's a cost element. Someone's there typing it out for you. Secretarial support, PA support. That's money spent on just the bureaucracy of healthcare. Then it comes back, you check it again, and sometimes it takes days to check a letter before sent to the doctor or the patient themselves. So that's much faster. It saved time, will save money long term, because cost of the actual AI doing this for you is fairly minimal and it's scalable. So actually I think in some circumstances, AI scribes helped enormously. The other thing to think about is the time spent with the patient. If you think about a consultation, now, I'm a surgeon, I have been for 30 years, and for most of that part I was a cancer surgeon. Now, if you have an appointment with a cancer patient, you're spending time with them, with the family, breaking bad news, explaining the CT, MRI, PET scan findings, the blood tests, then the treatment options, and for me that was surgery. That all takes time. I remember going back about 10 years ago, I had medical students in my room with me. I asked medical students to time me and how much time I spent with the patient. These are cancer patients in the clinic. How much time I spent on the computer looking for results, looking for the MRI reports, then doing the letters, dictating them, etc.
You did your own internal research?
I did, yeah. I thought, let me see how much time it takes. They were just marking, they were measuring the time in the background. I spent probably less than 30-40% of the time actually with the patient. 60% of the time I was spending time looking for results, doing looking for analysis of bloods, for example, looking at previous letters and correspondence. That's 60% of my time wasted almost. Now the newer EHR platforms who have AI built in, you can just interrogate, ask the question, give me a summary of the last few clinics, for example, or who have they seen before? What about their blood tests? That will save an enormous amount of time. So I can see how that has a huge benefit. And AVT, ambient voice technology, is lowest hanging fruit. It's easy to deploy. You're not making clinical decisions. We're not making clinical autonomous decisions. It's helping support make those decisions. So it basically keeps you in the loop and does make AI responsible for those decisions.
We'll continue this discussion, but first I need to check where exactly we're going because I'm very confidently.
Right turn there earlier.
Really?
Yeah, because I saw. Oh, here we are. There we are.
Hello.
Yes,
How long did it take you to write it? What was the hardest thing to write? Which topic did you feel was the most difficult one?
Yeah. Let me tell you about a story about the book and how it's taken. It's taken too long, if I'm honest with you. I started writing the book in 2019, and essentially at that time, I had a book contract with a publisher because I was at the interface of technology and innovation in healthcare. I started writing the book on innovation technology as a whole, and AI was one small chapter of that wider book. But of course, I started writing it, wasn't happy with the story I was telling, and also I wasn't quite happy with the direction the book was taking. And then COVID came. So I've written about 2/3 of the book. COVID came, and it changed everything because the things I was saying in the book, the innovation, COVID was facilitating much faster. So the book became irrelevant very quickly. Then after that, I took my time. I wrote a lot of articles, of course, on technology. For the last 2 years, it became evident that book had to be an AI book rather than just technology as a whole because the area was so rapidly expanding. So what we did then was, last 18 months, I focused much harder. I started writing the book. I was waiting for someone else to write a book before me, but no one was writing it, so I felt that it was my responsibility. As I've learned how to teach on AI globally, deploy AI, work with companies, it became sensible that that was a topic to write. The hardest part was saying, how do I tell a story about AI? You know, Tasha, I'm a storyteller. That's how I see myself. And how do I tell that story of AI in a way that's inspiring, that makes sense, that people understand in a better way? I could have been just a technical book. This is AI. This is what it means. This is how it's used in radiology, for example. That wasn't really the storytelling I was after. And only recently, last 6 months, I thought, right, this is the story. This is how I position the book. I'm very happy with that. So the hardest part was getting the story right. Not sure which way we're going now. There's Old Town, Toronto.
I am. It's such a nice view, though. Let me just show it.
Can you? There's no lights there, so you can walk. I think.
Huh?
There's no lights there, so you can walk.
I guess so. Thank you very much. Gonna go a bit faster. Ah, what a beautiful view. Did you leave anything out intentionally? Is there a topic that you were thinking about but decided that maybe it's not on you to cover it?
By the end of the book, I had covered more or less everything that I wanted to cover. But of course, AI changed so rapidly. So inevitably, things will move on very quickly. And I'll update the book as required. But I cover the history, the evolution, the timelines, the kind of the milestones. I also cover the language of AI. A lot of people don't understand what the language means, whether you talk about medical superintelligence or you talk about LLMs or other things. I've tried to lay out that information so people understand what those terms mean. Then I've gone to every single specialty throughout the book. And at the end, I've covered the rules and regulations and the framework that we're working towards. And then, of course, a new chapter I put in at the end was the economy of intelligence. Who pays for it? Yes, it's great. How do we fund it? What's the expense required? What's the resource issues? Especially when computing is so expensive when you're using these AI tools. And at the end, I finished by relating to that human agency at the end. So I think I've covered the story beginning to end, I think, overall. I'm sure I've missed out a number of areas which I'll reflect on. But what I'm really keen on is people reading the book, giving me feedback, critiquing the book to understand what they think about the book and how I can improve it going forward. And where I've made errors or misjudgments, then to tell me so I can actually reflect on those as well. Because all of us are learning AI together. It's not about one person. This is my thought, my expression. Others have their views. And I want to incorporate as many views as possible to make the book much more credible and more reflective of the general population. So we're learning AI together. And this is, for me, a journey like anybody else. I know so much, I know certain things, I have huge gaps in my knowledge, of course. But I'm working hard to kind of fill those gaps as we go forward. But I hope people appreciate that.
Given that you mentioned, gaps and, in a way, fascination and capability with AI, you kind of got known in the digital health space because you were one of the first surgeons, together with Rafael Grossman, to use VR and augmented reality in surgery. So what fascinated you most, when AI started entering more intensely in healthcare? Like, how do you feel the difference between the AI that you saw before the large language models and the bigger or the broader accessibility of AI, and how did that impact you as a surgeon, as a humanitarian?
So one of the themes of the book is around the concept of punctuations. People talk about these exponential changes that are taking place. What I refer to in the book, in the first chapter, in fact, it's around the evolution. And there are two theories that I come up with. One is around the theory of evolution by Darwin. And Darwin talks about the slow incremental change, or the survival of the fittest. And in his book, The Origin of Species, he describes slow change over millions of years that's led to where we are in humanity. It's a concept, it's a theory of evolution that works at a certain level. But it's at a certain point. So I talk about then the theory of the punctuated equilibrium by Stephen Gould, who was at Harvard. And he talks about these punctuations that change our trajectory. So yes, we move slowly along, humanity does. Suddenly something comes and changes our trajectory entirely, whether it's fire, electricity, the light bulb, the motor car, the aeroplane, and now of course it's the computer, the internet and AI. Each of those just transforms where we are and where we're going today. So what I describe as those punctuations, and AI for me is another punctuation, maybe a longer one over a period of time, but that's what we are. So therefore, we manage every other punctuation before without affecting the way it affects the way we behave. We learn from that, we adapt. So if you get back to the adaptation that Jar was talking about, I think AI is also an element of how we adapt to that change. Perhaps the most important adaptation for the last 50 to 100 years. That's how I describe that journey, so people understand that actually we shouldn't be scared of it.
Absolutely. Well, Shafi, thank you so much for sharing your thoughts about the book. And now I think it's time for us to actually look on the map, because I feel like we're walking in circles. It is a beautiful day though, and thank you everyone for being with us in Toronto, from Toronto, for Faces of Digital Health. This is Tiasha Zeit. I've never said that.
Oh, we should say it more often.
Bye.
Bye-bye.